Are you putting artificial tears in your eyes every single day and still feeling miserable? You might be believing harmful myths that are actually keeping you from getting real relief. Hi everyone, I'm Dr. Horwitz, and in my almost 30 years of treating dry patients, I've seen the same myths over and over again, and they're costing people months or even years of unnecessary suffering. Today, I'm going to debunk the 8 most harmful dry eye myths that could actually be harming your vision. You'll learn why drinking more water won't fix your dry eyes, the truth about artificial tears that many doctors won't tell you, and why your watery eyes might actually mean you have severe dry eye. Now, before we dive in, if you're new to my channel, I share evidence-based eye health tips that you can actually use. So hit that subscribe button and let's get started. First, let me quickly explain what dry eye syndrome really is, because it's not just a little dryness. This is a serious medical condition affecting over 16 million Americans, where your eyes either don't produce enough quality tears or those tears evaporate way too quickly. Your tear film has 3 critical layers: an oil layer that prevents evaporation, a water layer that provides moisture, and a mucus layer that spreads the tears evenly. When any of these layers is disrupted, you get uncomfortable symptoms that can actually progress to vision-threatening complications. And here's a shocking statistic. Studies show that untreated dry eye significantly increases your risk of corneal infections. So let's bust these myths right now. Myth number 1, and this is probably the most harmful one. Quote, dry eye isn't serious, it's just annoying, end quote. I hear this all the time. Patients come in and they say, it's just dry eyes, doc, but here's what they don't realize. Untreated dry eye can cause corneal ulcers and scarring, permanent vision loss in severe cases, chronic pain and discomfort that completely impacts your quality of life, and increased infection risk because your tears are literally your first line of defense. The truth is, dry eye is a progressive disease. Early treatment prevents complications and preserves your vision long term. This is not something to ignore. Myth number 2, just drink more water to fix your dry eyes. Now, I literally hear this all the time. Someone will say, my mom told me to drink more water for my dry eyes. Now, hydration absolutely matters, and being well hydrated does help your overall tear production, but drinking more water alone will not cure your dry eye problem. Here's why. Your tears are produced by specialized glands with a complex 3-layer system. Most dry eye cases involve something called meibomian gland dysfunction. That's blocked oil glands. The oil layer prevents tear evaporation, and while staying hydrated helps with the water layer, it cannot fix oil gland blockages or inflammation. So yes, stay hydrated. It's part of good eye health. But proper dry eye treatment targets the specific layer of your tear film that's problematic. Sometimes it's inflammation, sometimes it's gland dysfunction, and sometimes it's both. Hydration alone just isn't enough for most dry eye cases. Myth number 3, only old people get dry eye. Now this is completely outdated. The shocking reality is I'm seeing more dry eye patients in their 20s and 30s more than ever before. Now why is this happening? Screen time explosion. We're averaging 7+ hours daily on screens. Reduced blink rates while focused on devices. Indoor air conditioning and heating, contact lens overuse, and autoimmune conditions affecting younger populations. Here's a fact that'll blow your mind. Your blink rate actually drops 60% when looking at screens, leading to faster tear evaporation. Myth number 4, artificial tears fix everything and that's all you'll ever need. This is one of the most frustrating myths because it keeps people from getting the comprehensive care that they deserve. Now let's be clear. Artificial tears like Refresh Tears are absolutely the right place to start. As I mentioned in my first video, they're our first-line treatment. But the myth is that they're sufficient for everyone, and this can keep people stuck without the relief they deserve. The problem comes when that's all that's recommended. I see patients who have been told, quote, just keep buying more artificial tears, end quote, for months or even years, spending hundreds of dollars without getting the relief that they deserve. If an artificial tear is not working after a few weeks, that's my signal to dig deeper. They provide temporary lubrication, but they don't treat underlying inflammation or fix meibomian gland dysfunction. And if that's the root cause, you'll keep struggling no matter how many bottles you buy. I had a patient once by the name of John who had been told by his previous doctor to just keep taking those artificial tears for 2 years. He spent over $300 annually with minimal relief. When we did a proper evaluation and found that he had meibomian gland dysfunction, we added targeted treatment for that specific problem. His symptoms improved 90% within 6 weeks. Artificial tears are step one, but not the final answer. Effective dry eye treatment requires identifying and treating the root cause when first-line treatments are not enough. Myth number 5, dry eye only happens in dry climates. Now here's a surprising fact. Some of my worst dry eye cases live in humid climates such as Florida. What matters more are indoor environmental factors, air conditioning and heating systems, poor air quality and pollution, allergens triggering inflammation, and low humidity indoors, often 10 to 20% when you need 40 to 50%. Here's myth number 6. Contact lenses always make dry eye worse. The modern reality is that new contact lens technologies can actually help some dry patients. We have specialized contact lens designed for dry patients, moisture-retaining materials and daily disposables, and advanced options for severe cases. I had a patient once by the name of Jennifer who couldn't wear contacts for 3 years due to dry eyes. With the right specialty lens and treatment plan, she's now comfortable wearing them 12 plus hours daily. Myth number 7. Dry eyes should feel dry, but here's the plot twist. Many of my most severe dry patients have excessively watery eyes. Now, why does this happen? Poor quality tears trigger something called reflex tearing. Your eyes overproduce watery tears to compensate, but these reflex tears do not provide proper lubrication. The result, watery eyes that still feel dry and irritated. Watery eyes can be a sign of severe dry eye syndrome requiring immediate treatment. Myth number 8. Home remedies cure dry eye completely. You'll find countless home remedy suggestions online. Things like warm compresses, humidifiers, omega-3 supplements, and eyelid hygiene can provide temporary relief, but they rarely address the underlying problem. You need professional treatment if symptoms persist despite home care. You have vision changes or eye pain, discharge or redness, or symptoms are interfering with your daily activities. So what's the right approach? At our practice, we use advanced diagnostic tools to identify your specific type of dry eye. We do comprehensive dry eye evaluations, not just basic eye exams, and tear film analysis to measure quality and quantity. Our most effective treatments include prescription anti-inflammatory drops such as Restasis and Xiidra, in-office meibomian gland expression therapy, punctal plugs for tear retention, and customized treatment protocols based on your specific needs. Here's what I want you to remember. Dry eye is a serious medical condition requiring professional treatment. Drinking water alone will not cure it. All ages can develop dry eye. Artificial tears are the right place to start, but if they're not working after a few weeks, you need to dig deeper for root causes. And watery eyes often mean severe dry eye. Get evaluated immediately. Remember, every day you delay proper treatment is another day of discomfort and potential complications. Don't let these myths keep you from the relief you deserve. If this video helped you understand dry eye better, give it a thumbs up and subscribe for more evidence-based eye health content. And let me know in the comments, which of these myths did you believe? I read every single comment. In my next video, I'm going to show you the #1 dry eye treatment that actually works for most of my patients. You're not going to want to miss that one. Thanks for watching, and I'll see you next time.